A migraine is a very painful, recurring primary headache condition. Migraines typically produce much more serious and painful symptoms than other headaches. Even some forms of migraines don't cause major head pain, though. Secondary migraines occur as a side effect of another illness, like an infection, chemical overdose, stress, or drug abuse. Sometimes they can even be a symptom of more serious underlying issues. Many people suffer from migraines on a fairly regular basis, but what causes them varies from person to person. A person with migraines may not even be aware that there is a problem. In fact, many people who have migraines may not realize that they are sick, too. While migraines are very painful, some people hardly feel anything at all when they have them. Headaches are classified according to the location of the pain in the head. Common migraine headaches usually affect the lateral or frontal parts of the head, while cluster or pulsatile migraines affect only the temporal region of the head. Migraine headaches can also be very intense, lasting several hours at a time. They can also produce very intense nausea. Some people believe that headaches are caused by psychological problems, but there is no evidence to support this theory. Stress, anxiety, and certain medications may trigger a headache. However, headaches are also caused by blood clots that can be caused by physiological abnormalities such as cerebral palsy. Some medicines may also interfere with headaches, including some forms of aspirin. There are many different methods used to treat migraines. Some people swear by certain foods or certain medications as ways to help reduce the intensity and frequency of migraines. Consuming foods that have lots of vitamin C, like citrus fruit or cold-pressed lemonade, can help reduce tension. Certain medications, including beta blockers and anticonvulsants, can help to alleviate headaches caused by these triggers. When you eat or take certain medications, it's important to let your doctor know so that your treatment can be altered to accommodate the medicine. If you suffer from migraines that last for more than 6 weeks, you should see a doctor. He or she will do blood tests to determine if you have migraine status migrainosis, a condition that requires treatment with special medicines. Sometimes these medications can cause rebound headaches, meaning they can be caused by using the same type of medication and then stopping it. Doctors will often recommend treatments for headaches that last for more than 2 weeks. One of the common triggers of migraine smells. If you've got a smell that always bothered you when you were younger, it may occur when you're getting migraines. Smells that are familiar to you, like vanilla or candy, may not bother you so much now, but they may occur more frequently when you're suffering from this condition. Migraines come in many shapes and sizes, and they can feel very intense at times. You should be able to find one type of headache that makes your life miserable. Migraines can be triggered by anything from exercise, the weather, stress, and even chewing on something hard. The intensity and duration of your pain can vary, and you may not experience migraine pain every time you have one. However, knowing the triggers can help you stop your migraines from occurring too frequently. One of the main risk factors for getting migraines is if you suffer from one side of your head only. This can be compared to having double vision in one eye. Your brain needs to use both sides of your brain for processing. This condition is called hemifacial bipolar disorder, and you may also experience symptoms such as decreased consciousness and slowed reflexes. If you experience 2 or more of these symptoms, you have a greater risk of getting migraines. You can prevent migraines by avoiding triggers that usually cause you to have headache pain. The 2 most common triggers are exercising and traveling. If you do exercises that trigger your headache pain, you should avoid doing them altogether. Traveling can be another trigger for your migraines, especially if you are going to be flying. Always make sure you lay flat on your back for the flight and try to sleep with your head elevated. Some of the other things that can trigger migraine headaches include light, sound, smells, and touching. Light causes your vision to become blurred, and the sound can sometimes also jar your senses. Touching your head and shoulders may even increase your sensitivity to your headache. Other smells may include cologne, perfume, and new shoes. In order to support your health and the proper functioning of your body, you should know all the migraine treatment methods available and choose the one that works for you. You don't need a prescription to get the vitamins and other important nutrients that your body needs. However, sometimes it may be necessary to take pills or even use prescription medication in addition to a supplement. When you do this, make sure that you are consulting with your doctor and not simply taking on your own vitamin supplement. Here are 3 popular methods of migraine treatment. Acute treatment. This is usually performed on an outpatient basis under the care of a specialist like a neurologist or a migraine headache specialist. One of the first steps is evaluating your individual case and coming up with an appropriate course of action. You will likely need to take several weeks off of work to allow your body to recover from your last attack. This is called acute treatment. The cause of acute migraine headaches is usually unknown, although there are known triggers that can trigger an attack. Some studies have suggested that stress and certain foods can also cause an attack. A combination of treatments will usually lead to a reduction in frequency and severity of symptoms and a return to normal activities in more than 90% of cases. In some cases, a longer course of treatment might be needed to prevent recurrence. Topical regimen. One common approach to migraine treatment is using topical medications. These are often the same as the migraine abortive drugs that doctors prescribe, such as triptans. They can have some serious side effects though, so you should be careful about using them if you have a history of kidney problems, especially with et al. In the context of acute treatment, these drugs are typically used on a short-term basis. There has been some recent evidence that they might help prevent migraine headaches in people with pre-existing cardiovascular conditions. The most recent systematic review of acute treatments for migraine showed that they are effective for about 3/4 of people with acute migraine symptoms. Abortive antidepressants were the most effective of all drugs studied. Other drugs for acute treatment include triptans, tramadol, ergotamine, and famotidine. The majority of these drugs can be purchased over the counter and don't require a prescription. Talk to your doctor before getting any of them. Natural herbal remedies. Systematic reviews have also shown that natural herbal remedies are effective for migraine treatment. 2 of the most common herbs that are used in the treatment of migraine are St. John's wort and passion flower. It is unclear why passion flower works better than St. John's wort at reducing the severity of migraines. Both herbs have positive reviews from users, but the one thing that these reviews have in common is that they aren't effective for everyone. The best way to decide whether or not a particular herb is the right one for you is to do your own research. You can find more information on this topic by looking through the many resources available at my site. For more, you can see the link below.